Hi friends, now I will discuss about management of hypernatremic dehydration. Hypernatremic dehydration. We all know what is hypernatremia. Hypernatremia is nothing but sodium more than 145 milliequivalents per liter. Here we will take a case scenario of a child with weight of 10 kilos with 15% dehydration, that is fluid deficit is 150 milliequivalent 150 ml per kg, and sodium is around 158 milliequivalents per liter. Mm, so first, in severe dehydration we should give bolus of 20 ml per kg, and always correct the sodium level slowly. In hypernatremia, if the sodium level is 145 to 157 milliequivalents per liter, correct over 24 hours. 158 to 170 milliequivalents per liter, correct over 48 hours. 171 to 183 milliequivalents per liter, correct over 72 hours. 184 to 196 milliequivalents per liter, correct over 84 hours. So now here the sodium level is 158 in this case scenario, so correct over 48 hours. Now we will calculate fluid deficit. Fluid deficit, because dehydration is 15%, fluid deficit is 150 ml per kg is equal to 1.5 liter. Maintenance fluid for 1 day is, according to Holiday Segas formula, 1 liter. For 2 days is 2 liters. So total fluid to be given over 2 days is deficit plus maintenance minus bolus. 1.5 liter plus 2 liters minus 200 ml is equal to 3.3 liters for 2 days. Not for 1 day, 2 days, because we should correct over 2 days. Total sodium should be correct over 2 days. So we should take total fluid required for 2 days. So we calculated maintenance for 2 days. So total fluid to be replaced is deficit plus maintenance for 2 days minus bolus 3.3 liters. In this hypernatremic dehydration, to calculate the electrolytes, it is little bit complicated, because in hypernatremia the intravascular volume is elevated because of increased osmolality due to increased sodium levels. This gives the false deficit of electrolytes, because there is increased volume, the electrolytes will be diluted. False deficit of electrolytes as the fluid is diluted. So to correct this false deficit, we should calculate free water deficit for electrolytes. It is little bit complicated. I will explain. Because the water is diluted due to osmotic effect of increased sodium levels in intravascular volume, we will not get correct levels of electrolytes in the fluid in the intravascular volume. So we should calculate the correct levels of electrolytes. For this, there is a formula. For every 1 milliequivalents per liter more than 145 milliequivalents per liter, there should be 4 ml per kg water to be free from total deficit. So for every 1 milliequivalent per liter raise more than 145 milliequivalent per liter, 4 ml per kg of water should be minus from the total deficit. Here the total deficit is 1.5 liter. So 4 ml per kg of water should be minus from the total deficit for every 1 milliequivalent per liter raise more than 145. For every 1 milliequivalent raise more than 170 milliequivalents per liter, 3 ml per kg of water to be free minus from total deficit. So here we have sodium 158 milliequivalents. So there is 13 milliequivalents more than 145 milliequivalents per liter. So for 13 milliequivalents for every 4 ml per kg, that is 4 ml per every kg means 10 kilos. For every 13 milliequivalents, 4 ml into 10 into 13, 520 milliequivalents of water should be minus from total deficit to correct the false deficit of false reading of the electrolytes. Okay, so 520 should be minus from 1500, because here, because of hypernatremia, there is increased intravascular volume. So to correct this one, we should minus the 520 ml. The free water should be minus from the total fluid deficit. So the water deficit to calculate electrolytes is 980 ml. Normally in hyponatremic and hypernatremic dehydration, directly we will take the fluid deficit from directly we will take this one in hypernatremic and hyponatremic. But in hypernatremic dehydration, for correction, we will minus the free water deficit from the total fluid, and we will take the fluid deficit for electrolytes. We will calculate the fluid deficit for electrolytes. Fluid deficit for electrolytes is equal to total fluid deficit minus free water deficit calculated by this method. 1500 minus 520 ml is equal to 980 ml. I think you understood. If you don't understood, please comment your doubt, then I will explain you properly. I think you people understood. Thank you. Now we will calculate the electrolyte deficit for this fluid deficit. So for every 100 ml of fluid deficit, 8.4 milliequivalents per sodium is deficit. So for 980 ml, 8.4 into 9.8 is equal to 82.2 milliequivalents. Sodium maintenance is 3 milliequivalents per kg. For 1 day it is 30 milliequivalents for 1 day. For 2 days it is 60 milliequivalents for 2 days. Bolus we have given in bolus there is 30 milliequivalents for sodium. So total sodium for 2 days is deficit 82.3 plus maintenance for 2 days 60 milliequivalents minus bolus is equal to 112.3 milliequivalents per liter for 2 days. Now we will calculate potassium deficit. Is 6 milliequivalents for every 100 ml fluid deficit. Here fluid deficit for electrolytes is 980 ml. For 980 ml it is 9.8. 6 into 9.8, 58.8. K plus maintenance is 2 milliequivalents per kg. For 1 day it is 20. For 2 days 40 milliequivalents per liter. So for 2 days total potassium required is deficit plus maintenance is equal to 98.8 milliequivalents per liter for 2 days. So this is how we will give the total fluid is 3.5 liters. Sodium required for 2 days is 112. Potassium is 98.8. So the complicated step here differing hyponatremic and isonatremic is because here there is raised intravascular volume due to osmolality effect of hypernatremia. There is false deficit of electrolytes. So this should be corrected by this method. I think you understood. Thank you very much.